Welcome to this video on the contraindications for the vasodilator stress test, which uses agents like dipyridamole or adenosine to assess coronary artery disease and myocardial perfusion. While this test is generally safe, there are specific situations where it may not be appropriate due to the risks involved. Let's go over the key contraindications you should be aware of. First, let's discuss the absolute contraindications. These are conditions where the vasodilator stress test should not be performed due to the high risk of serious complications. One of the main absolute contraindications is severe bronchospastic disease, such as asthma or chronic obstructive pulmonary disease, COPD. The reason for this is that adenosine and dipyridamole can cause bronchospasm, making the test particularly dangerous for patients with reactive airway diseases. Another absolute contraindication is significant hypotension or low blood pressure. Both dipyridamole and adenosine can exacerbate hypotension, which can be dangerous for patients who already have low blood pressure. The test is also contraindicated in patients with unstable angina or those who have had a recent myocardial infarction within the past few days, as the induced stress could provoke ischemia or exacerbate the condition, increasing the risk of a heart attack. Patients with high-degree atrioventricular (AV) block without a pacemaker are also at significant risk, as adenosine can worsen AV block, potentially leading to complete heart block. Additionally, those with severe aortic stenosis face risks of hypoperfusion during the test, which could lead to serious complications like syncope or heart failure. Severe uncontrolled hypertension is another absolute contraindication, as the test could potentially exacerbate the condition, leading to hypertensive emergencies such as stroke. Active myocarditis or pericarditis also poses a risk, as the increased cardiac workload during the test could worsen inflammation and lead to complications. Finally, if a patient has a known allergy to dipyridamole or adenosine, the test should not be performed due to the risk of severe allergic reactions. Now, let's move on to the relative contraindications. These are conditions where the test may be performed with caution, but the potential risks must be carefully weighed against the benefits. For example, patients with mild to moderate bronchospastic disease, such as less severe asthma or COPD, are still at risk for bronchospasm, so the test should be conducted with caution. Patients with first-degree AV block or bundle branch block should also be monitored closely, as these conditions could be exacerbated during the test. Similarly, those who have recently experienced a cerebrovascular accident, stroke, or transient ischemic attack, TIA, may be at increased risk of recurrence, requiring careful consideration before proceeding with the test. In patients with severe coronary artery disease, the test could precipitate significant ischemia, although it may still be indicated for diagnostic purposes. The same caution applies to patients with unstable or severe heart failure, where the test could lead to decompensation or worsening of symptoms. Pregnancy is another relative contraindication. While not an absolute contraindication, the risks of performing the test during pregnancy, especially in the first trimester, must be carefully weighed against the potential benefits. Additionally, patients with severe renal or hepatic impairment may have impaired drug clearance, increasing the risk of prolonged effects or adverse reactions. In summary, the vasodilator stress test is a valuable diagnostic tool, but it carries certain risks that necessitate careful patient selection. Absolute contraindications like severe bronchospastic disease, significant hypotension, recent myocardial infarction, and severe aortic stenosis must be observed to avoid serious complications. Relative contraindications require careful consideration, and in some cases, alternative diagnostic methods may be more appropriate. Thank you for watching. If you have concerns about whether the vasodilator stress test is right for you, please consult your healthcare provider.